Welcome to CharityVillage Connects. I'm Mary Barrell. For years now, particularly following the pandemic, we've seen many nonprofit professionals report feelings of burnout, stress, and depression, which are only increasing as falling donations and increasing demands for services continue during challenging economic times for Canadians. In this episode of CharityVillage Connects, we wanted to dive into the latest research on the well-being, or lack thereof, of nonprofit workers and seek out advice from experts to provide nonprofit leaders with the data, research, and potential solutions they need to improve their workplaces and address the issues impacting the mental health and well-being of their workers. To help us get an understanding of the key issues and potential solutions, please welcome Dr. Kate Toth, Director of Learning and Development at YMCA WorkWell. Kate does research in organizational health and applied psychology. Her research interests lie in mental health in the workplace, organizational culture, occupational health psychology, and employee well-being. Kate is a certified human resources leader with the Human Resources Professionals Association and has a PhD in health psychology and a master's degree in industrial and organizational psychology. Welcome to the podcast, Kate.
Thank you so much for having me, Mary.
What are you seeing in the data and stories from the field when it comes to how client incivility is affecting the mental health and well-being of frontline nonprofit workers?
So this is an interesting one. We've been tracking this over the past couple of years, but particularly last fall, we did a national survey in the nonprofit space just to try to get a sense of how high these numbers were. And what we found was startling, shocking, I think. In our WorkWell data, we found that 75% of nonprofit workers say negative client interactions impact their personal well-being. And that number jumps to 83% among childcare workers. So just a tremendous impact on people. And that's talking about frontline staff, but it's important to know that it's not just a frontline problem. When we talk to people of all levels inside the organization, they're reporting similar things. And it really it's hard to show up to work every day when we're worried about what kind of behavior we might face from the people that we serve in our communities.
That is really distressing. Even while we're relying so heavily on those frontline workers to do the important work that they do in society. In your research, burnout risk nearly quadruples for employees who feel strongly impacted by negative client interactions. What does this tell us about the urgency of addressing these experiences and how it might tie into retention challenges?
Yeah, so our WorkWell data shows a clear, urgent link between client incivility and burnout. And burnout is a very strong predictor of turnover. So when our employees are deeply affected by negative client interactions, they're nearly 4 times more likely to report frequent burnout. And so when we look at organizations with higher insight scores, so we at WorkWell measure organizational culture, employee engagement, employee well-being, and performance, and higher scores across those drivers, we find that those individuals report less incivility if we have those high organizational culture scores, et cetera. Although it's still significant at 58%. So more than 1 in 2, even in those high, healthy cultures, compared to those with lower scores where that incivility hits 89% of staff reporting that. And we see really similar impacts on employee net promoter score. So when we ask individuals, how likely are you to recommend your organization as a great place to work? When you have those higher insight scores, our survey tool is associated with lower rates of burnout. Only 4% of people in those cultures are reporting experiencing burnout often or extremely often. Lower turnover intentions, where we have 97% of people who still expect to be working at their organizations in 6 months' time, and higher net promoter score at a 95 out of 100. And we see the opposite is also true. So where we have lower insight scores, so demonstrating a less healthy culture, lower employee well-being, We see really high burnout scores. So 66% of people in those cultures are reporting that they're experiencing burnout often or extremely often. Turnover and tensions are super high. Only 36% of people expect to still be working at their organization in 6 months. And that lower NPS at minus 96, because that NPS is a 200-point scale from minus 100 on the one side to positive 100 on the other. So huge impact on recruitment, retention, and employer branding.
Right. I mean, can you give us, is there any anecdotal kind of examples of the kind of incivility that they report experiencing that would really help our listeners understand what we're talking about and the severity of how they're feeling?
Yeah, I mean, it can be everything from, rude behavior to disrespectful comments, just that level. We're not talking about, violence here at this level, right? Although there's a continuum that leads in that direction potentially. But it's just, somebody maybe raising a voice or using impolite language with you. And what's really interesting in this is when we think about frontline workers, particularly those who usually face that type of behavior first, there's a little bit of a frustration or a power dynamic that shows up in that. I was talking with a senior leadership team at a nonprofit a couple of months ago, and they were saying it's really hard for our staff because they do everything right. They follow the policy, they communicate it clearly and respectfully, they're kind, they're polite, they're trying to find a solution. And they're still faced with a very angry individual who comes right down when the leader tells them exactly the same thing. And so that level of frustration that can be felt in that is difficult to shake off.
And we're not talking, for example, reactions from people who might be suffering mental health issues themselves or drug addictions or that might otherwise make their behavior erratic or aggressive.
I think we're seeing this at a societal level. If we think about sort of pre-pandemic through the pandemic, I don't know about you, but I saw and experienced a level of polarization and then a change in behavior in terms of what seemed to be acceptable out in the world. So we're talking about the general public here. And while it would be nice to think that we could just say to everyone, just be a little bit more kind, please. That isn't a practical solution. So inside our organizations, we're dealing with a societal problem. And we have a duty as employers to provide a safe and healthy workplace for our employees. And that means dealing with these kinds of situations. And hopefully it's stopping them or preventing them at all. But where that isn't possible or practical, how do we support them in dealing with the interaction itself? And then in that post-incident recovery piece that I think is so important.
So, one finding that stood out to us was that 83% of childcare workers report that client incivility affects their well being. You mentioned that earlier off the top of this discussion. What makes the sector particularly vulnerable? Are there other sectors that are similar? And how can organizations better support these professionals?
Mm-hmm. So, childcare professionals, I think, are uniquely vulnerable because their work is highly relational, emotionally demanding, and often undervalued. So, they serve both children and parents, guardians, families, often navigating, really challenging expectations with limited resources. And so, when we think about other similar sectors, there would be things like shelter and crisis services, developmental services, healthcare adjacent nonprofits, anywhere where you're engaged in really a helping profession type of role where the emotional labor is really high and boundaries can be unclear. And so thinking particularly about the childcare sector, it's facing really significant systemic challenges and considerable change at the present moment. And it can be easy to say in the face of all of that, that there's nothing we can do to make the work experience better. But in our experience at YMCA WorkWell, that isn't true. We do need to focus on what we can control and what we can influence rather than the things that we can't control. But there are healthy childcare centers with wonderful cultures and high staff well-being. So what can we learn from those centers and apply to those that are struggling a little bit more. And I think the number one support strategy is around co-creating that supportive workplace culture, a place where you have high psychological safety, trust, and community. And so when those things are in place, you have the support around you, people you can rely on. Those are huge protective factors. Beyond that, training our leaders to have the skills to provide that human-centered, empathetic care, creating policies that empower staff to set boundaries and the skills to de-escalate conflict or negative incidents safely and successfully, and then support programs around people to support them in that post-incident recovery piece. So a culture where we can talk about our experiences and recover together.
Your Insights to Impact 2024 report showed that 76% of nonprofit employees are engaged, but 58% still report experiencing burnout. How do we make sense of this paradox? It's seemingly contradictory. Can someone be engaged in their work but still at risk of emotional exhaustion?
Absolutely. You can be highly engaged and still burned out. So in nonprofit spaces particularly, we attract people who care deeply about the work. In fact, the typical pattern that we see in our data is high engagement scores and then lower organizational culture and well-being scores. So these are areas that we need to support as nonprofits in Canada. Our people care, they are aligned with the values, but they need to be having a better day-to-day experience at work. So we know that work can support and protect our well-being, or conversely, it can harm us. What kind of workplace are we creating in our nonprofit sector in Canada? And so many nonprofit employees find a strong sense of purpose in our work, but do we have that sort of purpose portfolio approach where we have that strong sense of purpose outside our workplaces as well? So how do we set boundaries? How do we find purpose in areas beyond the work? Because the work can be all consuming, especially in some sectors where, we know that the care that we provide, we can't meet the needs of enough people. It's very high levels of care. Whether they have support or don't have support strongly impacts their well-being. If we think about shelter and crisis services, for example, developmental services, etc. So we need to really have time to rest and recharge, to come back stronger. And part of that is the culture that we create and the practices that we normalize inside those workplaces. And if we link this conversation back to retention, we know that nonprofits are challenged in competing with other sectors when it comes to compensation and total reward strategies. That makes it all the more important to work extra hard to ensure that the experience of work is outstanding. Otherwise, why would people stay? So this paradox tells us that love for the mission isn't enough. We need to protect the energy that employees bring to their work with better systems of care inside our organizations, and then more broadly in the sector with policy work, etc.
That's really well said. You explained that extremely well. Frontline supervisors and team leads report some of the highest rates of impact on well-being, more than even senior leadership. What do these middle managers need most right now in terms of recognition, resourcing, or support? What's missing there?
Mm-hmm. Middle management is one of the toughest roles in any organization, and I think particularly in the nonprofit sector. They absorb the stress from both staff and leadership. They manage up and down. They often have a great deal of responsibility with little authority. They still have individual contributor expectations, as well as the responsibility for leading their teams. Their workdays are filled with meetings, and then they still need to get their work done. They're the glue holding everything together, translating strategy into action, engaging their teams, navigating the ever-changing demands of programs, fundraising, community impact, and their well-being is under threat because of it. And moreover, we know that many managers receive very little management training until they've been in their role for over a decade. And so with all of that, what they need most, training and support to do the role really, really well, clear decision-making authority, pushed down as low inside the organization as is practical, opportunities for leadership coaching and reflection, ongoing growth, and protected time for team support and planning. If my 8-hour day is filled with 8 hours of meetings, when does the work get done?
Well, I've been there and I know what it's like. So I can attest that in my experience, you're certainly reflecting the challenges of being in middle management. And it's not an easy role. Now, the data shows disproportionate impacts on equity deserving groups, including women, 2S LGBTQIA plus, and non-binary staff. How can organizations take an equity informed approach to address these harms?
Yeah, so incivility doesn't affect everyone equally. In our WorkWell data, those groups that you just named are more likely to report that incivility harms their well-being. And so I think the key question here is why? So why do some equity-seeking groups report greater harm? Are they more likely to experience incivility? Or do they have a more difficult time recovering from incidents when they do occur? And so one of the things that I find most valuable about data is when it leads us to ask better questions, the questions that really matter. And talking to groups that experience greater impact is the first step to deeply understanding those experiences. And then we can co-create solutions that actually help and support. So the first step here is to have the data to understand what is going on inside your organization, because only then can you make the decisions that you need to make to have the greatest impact. So it's collecting and then disaggregating data. So not just organizational level, but breaking it down by teams, groups, locations, roles, etc. And then we can best understand who is being impacted and how.
I know it as a member of that group, it certainly included women, and we know that women make up the huge majority of the workers, if not yet the leaders of nonprofit employers and organizations. I'm curious, what do we make of that, given statistically the folks in those groups um, are showing disproportionate impacts. So that's an extraordinary sort of data point that is intersecting with the fact that most most workers in the nonprofit sector are women.
Exactly. And when you see generally statistics around mental health, around burnout, et cetera, women report those higher levels of those types of things as well. So we are being disproportionately impacted. And when you look at a sector that is very highly women, that's a sector we need to pay particularly close attention to.
Only half of nonprofit employees feel appropriately recognized at work. What does a lack of meaningful recognition, um, how does that intersect with the emotional toll of client incivility? And how might this erode staff morale over time?
Yeah. So recognition isn't fluff, it's a buffer against burnout. Yet only half of nonprofit employees feel appropriately recognized, as you noted. So recognition is about feeling like you matter, that you are seen, heard, and valued for who you are inside the organization, not just what you do. No one wants to feel like they are just a cog in a wheel, easily overlooked, easily replaceable. So when dealing with client incivility becomes just part of what we need to do around here, or the implicit message is just suck it up when it happens, that emotional harm goes unacknowledged and it compounds. So feeling unseen and uncared for erodes trust and morale. So think about it. How likely would you be to be excited about going into work if you knew that you were likely to go in and be yelled at that day, or that someone would be rude to you, or that you would be faced with an irate customer? And while that person was yelling at you, you had to remain completely calm and rational. It's a tremendous amount of emotional labor and it's exhausting. So we know that there is a difference between recognition and appreciation in the workplace, and both are important. And so when we think about recognition, it's often, top down, an organizational program that looks at what people do and reward that behavior inside an organization. And in our current sort of state, often it's a one size fits all. So we do staff appreciation days, we might do a summer barbecue, there's swag that everyone gets. We've kind of leaned into that space around recognition. But the appreciation happens in the smaller moments between people. And it really is about who you are and how you show up, not just what you do for the organization. And that appreciation piece particularly needs to flow in all directions inside an organization. So it needs to come from leaders to their teams, but also from teams to their leaders and peer to peer. All of that is important. And in fact, should span out into our whole care holder ecosystem, right? Where our clients are appreciating our staff and our staff are appreciating our clients. And so I'm reminded of a book by Zach Mercurio that is fairly recent, The Power of Mattering, it's called. And Mercurio presents a really simple sort of actionable framework to help people feel like they matter at work. So he talks about noticing, so truly seeing and listening to others, understanding their experiences and their contributions. He talks about affirming, so reflecting others' unique strengths and gifts back to them, not just offering thanks, but explaining why their contributions matter. So it's not just the blanket, thank you so much for all your hard work this week, but it's, Mary, when you showed up with that great sense of humor on Wednesday morning and I was having a tough day, you lightened my load. And I really appreciate you for that. It's a very different sentiment. And then the last piece of his framework is around needing. So demonstrating how someone is indispensable, relied upon, and essential to the team or the mission. And so those simple practices can be woven into everyday interactions, the way that we work together. And when we create that culture of appreciation inside our organizations, they become much healthier, happier places to work.
In one of your recent blog posts, you explore the link between employee experience and participant satisfaction. Can you talk more about what that connection means? How does improving staff well-being actually benefit the people we serve?
Man, this has been one of the most exciting things that we've gotten to do with our data over the past couple of years, where we actually get to measure the employee experience and then measure that experience of the customers that they serve and take a look at where are the links and the correlations in that data. And so there's that really strong link between how employees experience work and how our customers experience our services. You can't really separate the two. So when staff feel burned out or disrespected, it shows in how they show up for their clients. And investing in staff well-being is investing in service quality because humans serve humans. So it's because feeling valued is contagious and it shapes how people show up, more energized, more invested, more connected, and customers notice that. They feel it in the service, in the tone, in the follow-up. And so when we have healthier teams, we have better retention, which leads to more consistency for clients. Think about some of your favorite places that you go where you engage in service. Isn't it great to see that familiar, friendly face when you come in who knows your name and is able to say, "Hi, Mary, it's great to see you today. Here's your order," or whatever it might be, right? And then staff who feel healthy, supported, well, they're able to better emotionally regulate, right? And so they handle crises with greater skill and compassion. And then people who feel supported in dealing with the aftermath of a negative incident are better able to let that incident go. And so we can create a virtuous cycle where we care for our employees, they care for our customers, and we go around, or we can create a vicious cycle where the opposite is true.
And this sounds really terrific and fantastic advice. I guess I'd be curious about what kind of tools or resources or policies that you found most effective for organizations trying to reduce harm and build resilience on the front lines, particularly in emotionally demanding environments. Can you give us point us in the right direction to understand how we go about doing this?
Sure. I think there needs to be a three-pronged approach to dealing with this societal problem of incivility, because we've said it shows up in our workplaces. It's not unique to them. So the first is working to eliminate it altogether. And I think about when COVID hit, we started to see all of these signs pop up on front desks, from pharmacies to vets' offices to public libraries, right? Where it talked about disrespectful behavior will not be tolerated. So what do we do when someone is disrespectful, rude, or uncivil? Do we lean into that old "the customer is always right" mantra? Or do we reinforce that that behavior is not tolerated here? We've been talking a lot about customer, participant, public incivility here, but recognize that it doesn't just come from people that we serve. It comes from the general public And it can be inside our organizations too, with peers reporting incivility from peers, leaders, direct reports, et cetera. It can happen anywhere. And so do we ignore the top performer who treats the rest of the team like they are inferior, or do we do something about it? And one of the phrases that I heard a long time ago when I first started in this work, but has really stuck with me, is that our organizational culture is only as good as the worst behavior that we tolerate. And so whether we're thinking about the people that we serve or the people that we work with every day, we need to be thinking about, how do we work to eliminate this altogether, where we show up and deal with each other every day with kindness? Next, it's about training everyone in the organization on conflict resolution and de-escalation techniques, right? Give them the very practical skills that they need to remain calm and to diffuse a situation before it becomes really out of control. Help them have those tools at their fingertips. And then have the safety protocols in place to keep them safe at all times. So that's an organizational responsibility. And then the last piece that I've alluded to multiple times through our talk today is supporting people in that post-incident recovery. I think we forget about that piece sometimes. So have practices in place for this, from a peer hotline to a stress recovery area in the building, to leaders trained to support with empathy and support in the aftermath. There are lots of things that we can do to help people complete the stress cycle and be able to let it go. Because when we are able to process, complete that stress cycle, and go home at the end of the day without it weighing on us, without us ruminating about it, thinking incessantly about what we could have done differently, worrying about whether it's going to happen again tomorrow, then we can rest and we can recharge. And it doesn't compound and add to exhaustion, burnout, and ongoing things like that. So I can give you a very practical example. In our own YMCA of Three Rivers, which is where YMCA WorkWell is housed, we had noted that, at the start of the pandemic, that employee well-being was very much under pressure. And so one of the things that our Y wanted to do was to equip leaders to have what we termed well-being check-ins. So we created and launched this program. And so a well-being check-in in our organization's definition of it, or creation of it, was just a 15-minute conversation between each employee and their leader. It was focused only on employee well-being. So it wasn't about talking about work, doing a debrief on that project that we're working on, or anything like that. It was just, how are you and what do you need to be better supported? And so the goal here was really creating a supporting culture of well-being throughout our entire Y. We created this sort of concept of collective caring, as we called it. And we asked for each employee to have at least 2 well-being check-ins in a 6-month period. And so we built an entire program. We built tools around this to support people. We had handouts and flowcharts and all this kind of thing to help those who maybe weren't as comfortable with having these conversations to know exactly how to do it. We created a learning program for all of our leaders and trained 140 leaders inside an organization over a period of time. And then we've been following this to see what the impact is on employees. And it's had some really, really amazing outcomes. So 91% of our Y of Three Rivers employees believe that having a well-being check-in has had a positive impact on their well-being at work. We've seen a decrease in burnout. So if you hadn't had a well-being check-in, 41% of people were experiencing burnout often or extremely often. That was only 20% in those who had been having those well-being check-ins. So a decline of 21%, or a difference of 21%. We talked about employee net promoter score earlier, that how likely are you to recommend your organization as a great place to work? And we said it's a 200-point scale from minus 100 on the one side to positive 100 on the other. So for net promoter score, those who had not had a check-in had an average net promoter score of minus 26. And those who had a well-being check-in reported a net promoter score of 25. It's a huge difference in your net promoter score. For turnover intentions, 40% of employees who had not had a well-being check-in were considering leaving their role in the next 6 months. And that was only 18% for those who had a well-being check-in. And then when we looked at actual turnover, we were looking at a 6-month turnover rate of full-time employees of 12% in July of 2022. And by July of 2024, this was down to 8%. So a tangible impact on our turnover inside our organization as well. And so I think when we think about, that very practical example of the one small thing that we did inside our Y of Three Rivers to impact well-being, we can see those pieces of support being put into place. And that support has to be embedded in the organization, not just offered at the individual level. So how do you think about your organization as a whole and create that supportive culture?
Well, that is a great example, and certainly something that other organizations and other leaders can aspire to. And I'm curious, though, just to wrap up our discussion, which has been really fascinating. Finally, for leaders who are hearing this and want to take action and perhaps don't have the resources of a larger organization, where should they start? What are the first 2 to 3 things a nonprofit can do to begin shifting culture and addressing client incivility in a constructive way that really has meaningful change in the way in which they experience their work?
Yeah, so I think the first step is acknowledging the problem. So starting a conversation about civility openly and thinking about it from all the different aspects. Is it the people that we serve? Is it the general public? Is it inside our organizations? And the answer to all of these, of course, is yes. So understanding where it's happening, and how it's impacting people. Naming it as an organizational issue, not just a personal one, right? It's not an individual problem to solve. It is a societal one. And it shows up in our organizations, and therefore organizations, employers have a responsibility to help deal with it. Then step number 2, really listening to your people to better understand the issues. So you can use surveys, focus groups, anonymous feedback to understand where and how the harm is happening, how people are experiencing that, and making sure that you are disaggregating your data, looking at the differences between different groups, levels, types of work, etc. So paying attention particularly to the experiences of equity-seeking groups. Middle managers are showing up as some of those, sort of key areas in our data. And then really working to build that culture of care. So if you think about your organization as having a culture of care, where and how would that show up? If you operated from that guiding principle every day, what would be different? What else could you do? So normalizing, peer check-ins, debriefs, creating something like our well-being check-in program at the YMCA Three Rivers. Pretty simple, but a great place to start to just hear from people more often. Training your leaders to respond with empathy and action, and making well-being part of performance, not an add-on, those places that we can start. And so, you mentioned about the resources. These are things that any organization can do. But if you are a nonprofit and you're looking for some help and care and support, that's what YMCA WorkWell exists to do. We work with nonprofits to help the people who care for their communities care for themselves as well.
Well, Kate, the work you do is so very important, and we appreciate your incredible insights into how to support the well-being of some of Canada's most crucial workers that make up the sector and our society in general. And thank you for sharing your thoughts and advice for nonprofit leaders across Canada seeking to make meaningful improvements in the working conditions for the professionals in their organizations. Thank you for joining Charity Village Connects.
Thank you so much for having me, Mary. Appreciate it.